Yes, indeed. While they're joining me for health, I'm sure the question on everybody's mind is just how tall is Mary? Well, let's move on. We begin on health today with Dr. Olutubi Olawale, a physiotherapist with specialty in sport medicine and also orthopedics rehabilitation. He's here to discuss dislocations and fractures. Dr. Olutubi, you are welcome. Good to have you
Thank you very much. Again.
I enjoyed last week's one.
Yes.
And this week we're talking about something that most people have experienced. Well, some people have experienced. Depending on what your childhood was like. If you played a lot, you probably have had a dislocation or a fracture. If you were a hermit, like I was, you've never experienced it. But the fear of it, is there. So let's talk about these two. Let's first define what they each are.
Okay, dislocation and fracture, they're two different things. And people mostly confuse both of them together, dislocations and fracture. Dislocations occurs around the joint. Now, a joint is a point where two bones joins together.
Yeah.
So when there is a dislocation, a bone is moving away from its normal location. Mm-hmm. That is where we call dislocation. I'll use my shoulder as an example. This is my humerus. This is the shoulder joint. It's meant to be in this joint. When there's a dislocation, there's a movement away from the normal movement, from the normal joint. That's what we call dislocation.
Yeah.
There can be partial dislocation that we call that subluxation.
Subluxation. Partial dislocation.
Yeah.
But I can't even say these words without wincing because it's such a...
While fracture, on the other hand, is when bone breaks. Simple.
Okay.
So it can.
This could be anywhere. It
can be anywhere. It can be anywhere. It can be any part of the bone can break.
All right. So going back to dislocations now. Dislocations, are they in comparison with fractures? Are they harder to repair? Because when you dislocate it, that means that it's coming out of its normal position. It should just go back into place. And I've seen videos where people just pop their shoulders back in, blop, and then that's it.
One thing about dislocation is that dislocation is when there is a dislocation of the joint, the best thing to do is just to put the joint back into proper position at that moment. When there's when you're putting it back in the position, the pain comes down. Then you can go for further treatments, trying to do x-rays to check.
But now that's the thing, yeah? Putting it back into proper position, you have to know how.
Yes. That's where the first aid movement for any dislocation is that once you have a dislocation or anything or fracture, the first thing is just support that joint first.
Don't move it.
Don't move it. Leave it. Just use a sling or splint to support the place that's been dislocated. Leave it there. Then, when you get to an experienced physiotherapist or a doctor or someone that is experienced, can now put it back into position at that moment, then the patient will feel immediate relief.
Wow.
Because I've had a dislocation of my shoulder before.
Yeah, you keep referring to that one because it's happened.
This shoulder really hurts me when I dislocated my shoulder. But when it was put back in place, immediately I felt a bit relieved. Then
further treatment.
Well,
how long is too long to keep it out of place? Is there any time that if you went for an entire day, would that be permanent?
There can be complications, and it's best that once a joint is dislocated, it can affect surrounding tissues around it. It can affect the ligament, it can affect the tendon. Ligament is a substance, tissue that joins the bones to each other, while the tendon joins the bones to the muscles.
Oh, okay.
So when there's a dislocation, it can affect the tendon, it can affect the ligament, there can be a ligament tear, there can be a tendon tear. So that is why once a dislocation or fracture occurs, the best thing is to have a proper examination of this joint. Even if it is put back in place, have a proper examination. Well, that's why X-rays is very, very important, or MRI. Because we are not magicians, we cannot see what's happening there.
Yeah.
You just have to see. X-ray will give us a clearer picture, MRI will give us a clearer picture of what's happening there. Then you can further treat back.
Now let's talk about fractures and treatments for fractures. Now fractures they could be, like I've heard, there's a term hairline fracture. You can go for days just experiencing pain. Like, why is this thing aching? And then it gets worse. Can you define what that is exactly?
Okay, fracture, as I said, there are different kinds of fractures. There's open fracture, there's a closed fracture, and there's a kind of fracture that happens when your bones are weak due to probably a metabolic degeneration, that's osteoporosis.
Osteoporosis, yeah.
Then there's another fracture that can occur, a pathological fracture that can occur when the bone is, there's a cancer in the bone. So those fractures, you don't even need any greater force. Let me just put this in. Fractures and dislocation occurs when there is a greater force applied to your body, to your joint. So I cannot just hit you and your bone fractures or your bone dislocate unless the bone is weak. That's a metabolic fracture or the pathological fracture. Now, the kind of fracture you're talking about, we call it stress fracture.
Okay.
Stress fracture. Now, I've been using my leg, I've been using my leg every time, I've been running every time. I'll just discover there's a little bit of pain, just a crack. That's kind of stress fractures. Overuse of a joint, of a bone, can cause stress fracture. Those are the kind of fractures we have.
Does one need to be put in a cast to get that to heal?
Fractures, the management of fractures depends on the severity. Because once there is a fracture, the best thing to do is, if it is not severe, it can just be put in place. Because one thing about fracture is that bone heals itself.
Yeah.
The moment the bones are together, it can heal. Depending on the kind of fracture now, there's a transverse fracture, there's a communicated fracture. That's where there's fragments of bone. That means you can go for that's fracture surgery.
Okay.
So depending on the kind of fracture, you can have a cast, you can have a surgery, you can just put in the boot. But management of fractures depends on the severity.
Okay.
And it shouldn't be done anyhow. Because
Cast can stay for as long as how long, real quick?
a cast can stay for as long as 2 to 3 months.
Months, okay. So that's how fast the bone could repair.
Yeah, bone can heal in 2 to 3 months. But full healing of bone occurs for over a year or so.
Yeah, okay. Now, there's one fracture that people, or dislocation, I don't know what you want to call it, that people are most scared of, and that would be of the jaw area.
Yeah.
Or even a crack in the skull or anything. I mean...
jaw fracture. There's a joint in the jaw. It's called jaw dislocation. When there's a dislocation of this jaw from the normal position, it's called, that's a jaw dislocation, the dislocation. And it can be fractured too, because there's a bone there that can fracture it too. So where physiotherapy comes into play in this thing is that once your joint is being in place, your fracture is healed, physiotherapy teaches you how to manage you how to walk back and strengthen the muscles around the fractured and dislocated joint.
Okay.
Because if the muscles around this place is being strengthened, it can't dislocate again. Because
jaw dislocation, however, I can't wear a mask, a cast, but would I have to have my teeth wired into place or something?
it's going to be the surgeons that are going to do that. They're going to put it back into place.
Wow.
Doctor
in the house, thank you very much. Are you married, by the way?
Yeah, I'm married.
Oh.
Thank you.
Too bad. I was going to help you guys out there, but unfortunately he's married already. But not to worry. He'll be back again next week to give you some eye candy. We know why you tune in. Do stay tuned. We've got more inside of Wake Up Nigeria. Thank you very much, Doctor.